Why is opioid rotation used for raw pain relief? Imagine dealing with rheumatoid arthritis pain that just won't go away, even after trying different medications. Sometimes, doctors suggest switching from one opioid to another. This process is called opioid rotation. It is used when a patient's current opioid isn't providing enough relief or causes side effects that make life harder. The goal is to find a medication that manages pain better and is easier to tolerate. Every person responds differently to opioids. Some may develop tolerance, meaning the same dose becomes less effective over time. Others might experience side effects like nausea, constipation, or drowsiness that interfere with daily life. Instead of simply increasing the dose of the current opioid, which can increase risks and side effects, doctors may switch to a different opioid. This switch can sometimes provide better pain control at a lower dose, reducing side effects and improving quality of life. Research shows that rotating opioids can lead to modest but meaningful improvements in pain scores. For example, switching to medications like morphine, oxycodone, or methadone has been linked with significant reductions in pain. Methadone, in particular, has shown promising results because it can decrease pain while also lowering the overall opioid dose needed. Studies also indicate that patients who undergo opioid rotation tend to have more successful pain management visits and fewer adverse events compared to those who do not rotate. However, it is important to understand that opioids are not generally recommended for long-term management of rheumatoid arthritis pain. The evidence suggests that using opioids over a long period does not improve pain-related function and may even increase risks, such as fractures. Instead, managing raw pain effectively involves treating the underlying inflammation with disease-modifying drugs and incorporating non-drug approaches like physical therapy, education, and lifestyle changes. When opioid therapy is necessary, healthcare providers carefully monitor the patient's use, check prescription drug monitoring programs, and set clear goals for treatment. They also assess risks regularly and avoid escalating doses too high. Patients should be aware that opioids do not treat the disease itself and should be used cautiously to prevent misuse. The decision to rotate opioids should always be a collaborative one, involving the patient and their healthcare team. It's important to consider whether the pain is due to ongoing inflammation, joint damage, or other factors. This personalized approach helps ensure that opioid rotation is part of a broader, safer pain management plan tailored to each individual's needs.